We all know that we should be getting our kids to eat more veggies, particularly green ones, which are full of B vitamins, have anti-cancer effects, protect against heart disease, and help prevent obesity by being nutrient-dense and calorie-poor. But those aren't messages that an 18-month-old toddler will necessarily engage with, unless, of course, you've bred a budding Einstein. There is hope, though. Dr. Valerie Duffy, an expert on taste and vegetables at the University of Connecticut, has some tricks you can try, which you may or may not like the idea of.
Early exposures, even during birth, if your mom consumed vegetables while pregnant and you were breastfed, you get all of the tastes and flavors of vegetables that are transmitted through the either amniotic fluid or breast milk.
So breast milk can taste of broccoli?
Yes, it does condition or help expose the child early on to the flavors of broccoli or vegetables. Children vary in their ability to accept vegetables because they vary in perceived bitterness of vegetables.
So children taste differently?
Well, we all do. And this is something that you're born with, a genetic variation, that you get more bitterness from vegetables, which suppresses any natural sweetness. As a child ages, only about 6% of them consume the recommended amounts of vegetables. So we really have to do more to encourage vegetable consumption.
Tell me about your research in this area.
Well, we've done work with preschoolers. What we did is to mist the vegetables with just a little bit of sweetening. So this would be probably less than a half a teaspoon of sugar to a half a cup of vegetables, that equivalent.
When you're cooking it or before you eat it?
Well, actually we did these by just before the child was to eat or to taste cooked vegetables. And 2 of the 3 children liked the vegetable, and these were vegetables like broccoli, collard greens, spinach. They liked the vegetable more with a little bit of sweetness. After 3 or 4 weeks, the children in the intervention with the lightly sweetened vegetables consumed significantly more vegetables than did the control classroom. What we're trying to do is we're trying to get the child to taste the vegetable and have the initial experience positive, because we are born liking sweet. It's a cue for calories in food. And then removing the sweetness after a couple of exposures. And this was actually some work done by Elizabeth Capaldi and her lab. They found that just exposing a couple of times to the sweetness then enhanced the preference for unsweetened vegetables. And so it's just to help develop a preference.
So are you at the stage yet where you can make a recommendation to parents?
For parents, what I would recommend is early exposure. If the mom can consume vegetables during pregnancy, if the mom can breastfeed, and then in weaning, continue to expose vegetables. If the child still doesn't respond, try a variety of ways of blocking bitter. One is through just a little sweetness, and this could even be just throwing a little bit of sugar in the cooking water of the vegetable, or at the table, if they wanted to try the misting, that's one thing. Or you can also use like dip, and this was work by Julie Manella and Jenny Fisher, using just a little dip for broccoli.
What was in the dip?
It was like a ranch-style dip with some seasonings, but it's the fat that helps block the bitter. And that really improved, especially for children who are sensitive to bitter, born with a sensitivity to bitter. The dip helped improve the liking and also consumption of the broccoli. And finally, you can add just a little bit of salt. Just a little bit of salt. And then, with all of these things, you could actually start reducing the sweetness even further, or the amount of salt, or maybe not use so much dip. But again, it's to help develop a preference for vegetables.
And is there a calorie issue with adding sugar or fat to this?
Well, people should know that a teaspoon of sugar is only 16 calories. And even when we say we have a sweet tooth, it's really a fat sweet tooth that we have. So just a minimal amount of sweetness, so that would be like less than 8 calories per half a cup of vegetables, is really minimal, especially if your child is going to consume the vegetables. And again, I have to reinforce that it's not like the child has to have sweetened vegetables forever.
And do you know from research the true extent of the parents setting an example. So the parents eating a vegetable and whether or not that encourages the child to eat a vegetable.
Well, I can quote others' work. Jackie Blissett from the UK did a very nice study where she looked at maternal consumption and found that that beautifully predicted a child's consumption of vegetables, except if the child was sensitive to tastes and smells from vegetables. And that could be like a genetic sensitivity, like a genetic super taster. Even though the mom consumed the vegetables, that genetic sensitivity or that sensitivity to taste and smell overrode that maternal patterning, and the child didn't consume as many vegetables.
So if you see a strong aversion in your child to the vegetable and they gag or just don't like the taste,
then work with them. Don't make it an issue, but do pay attention to the taste and see if you can modify the bitterness with salt, sugar, or even a little fat like dip.
I mean, there are other things that affect a child's taste.
So we actually noticed or reported that children who had high exposure to middle ear infections, and these were preschoolers, so between 3 and more than 6 bouts of middle ear infection, actually had the lowest liking for vegetables and also had higher body weights than the children who had less exposures. So that is an association study, but there's lots of basic and clinical research that suggests that the reason we saw this association was because of taste, and that the middle ear infections may change the taste of vegetables and make them less sweet and more bitter. So another reason to look at taste as a reason why your child may not be consuming vegetables.